Hey everybody, welcome to the final video of section 7.2. This is part C. A lot of this video is going to be talking more in depth on the cranial fossae. So each fossa is going to be formed to the shape of the area of the brain that it holds. We took a look at the fossae in an earlier video, and you saw kind of where the anterior, middle, and posterior fossae were, and the general areas of the brain that they were holding. So the anterior fossa is going to be bound by the frontal bone at the front. So that makes sense because that's going to be the frontmost one. And on the posterior side, your anterior cranial fossa is going to be marked by the lesser wings of the sphenoid bone. So you can see here, this is the anterior. Here's our face here. This would be the anterior cranial fossa, and you can see where those lesser wings of the sphenoid bone are going to mark the boundary. At the midline of the anterior cranial fossae is going to be that crista galli and the cribriform plates. Remember, those are part of the ethmoid bone. In the middle cranial fossa, it's going to be bound at the front side by those lesser wings. So that's the same demarcation between the anterior and middle. And the petrous ridges of the temporal bone on the back side here. So these petrous ridges. You can notice that it has kind of a general butterfly shape here, sort of like almost hourglass or butterfly shape, however you want to think of it. And at the midline right here is our sella turcica, and there's tons and tons of openings. I don't know if I flip this around here, you can see all sorts of different openings that are found within the medial or the middle cranial fossa. And then the posterior, oh, sorry, I forgot I was going to mention some of these. Here are a few of them. I'll just throw them all on right now. There we go. Okay. So you have some different ones. You have the optic canal. I'm not going to be able to do a very good job of showing you these here. The optic canal is anterolateral, so front and to the side of the sella turcica. So just to give you an idea, again, here is the sella turcica. So anterolateral, front and to the side. Hopefully you're able to see that optic canal there. It's going to provide passage for the optic nerve. You also have the superior orbital fissure. Hopefully you're able to see that in there. The foramen rotundum, which is a round opening in the floor. You're going to have a major sensory nerve for your cheek, nose, and upper teeth to flow through there. You have the foramen ovale, where a sensory nerve to the lateral head, cheek, and chin, as well as the lower teeth will flow. The foramen spinosum, which sits posterolateral to the foramen ovale. See if I can organize myself here. There we go. And that's going to be an entry point for the artery that supplies the meninges, the protective one of the protective layers of the brain. And then you also have the carotid canal, which is a zigzag sort of passage here, where a major artery to the brain is going to enter the skull. So very difficult to point out. Some of these are fairly small, so we're just going to talk about those there. In your posterior cranial fossa, this is going to be where the cerebellum of the brain is going to sit. It's bounded on the anterior side. You have the petrous ridge of the temporal bone, and then the occipital bone on the posterior side there. At the midline, you have the foramen magnum, which is just big hole. That's going to be where the spinal cord is actually going to exit the skull. Your internal auditory meatus in here is going to provide passage for hearing, equilibrium nerves, nerves to the muscle of the face. On the anterolateral margin of the foramen magnum is your hypoglossal canal. That's where hypoglossal is going to deal with parts of your tongue. And so that's an important nerve for your tongue. It's going to pass through there. And inferior to the internal auditory meatus is the jugular foramen, where you're going to have several cranial nerves exiting, plus some other things, veins that are carrying blood away from the brain. Okay. Your paranasal sinuses, these are hollow air-filled spaces. They're connected to the nasal cavity. They are lined with mucosa. I'm not going to be able to show you them with this particular skull here. But the purpose or the function of your paranasal sinuses is to help reduce the weight of your skull and it's also going to add some resonance to your voice. So this is also why when you're having a runny nose, your voice sounds a little bit different, is because all that mucus filling those paranasal sinuses, which results in a different resonance than you're used to your voice. The paranasal sinuses are named for the bones that they're going to occupy. So the frontal sinus is in the frontal bone. The maxillary sinus is in the maxilla. Sphenoid sinus in the sphenus. And your ethmoid air cells, which we mentioned earlier, are not really a sinus. They are air cells. They are connected to the nasal cavity. So depends on who you're talking to on if they count. But you can see that frontal sinus there, that frontal bone is hollow in that region, so that area is going to be lined with mucosa. You can see the sphenoid sinus, the ethmoid air cells, and your maxillary sinus, where those are going to fit within those bones. Okay, another bone that kind of gets ignored a lot because it's not technically part of the skull, but it's not really technically any part of anything else, is the hyoid bone. So the hyoid bone is special because it does not articulate with any other bone. It really does exist kind of on its own, and it serves as a base for the tongue. So this is going to be the bone that the tongue is attached to. On the inferior side, it's attached to the larynx, and on the posterior side, it's attached to the pharynx. Sorry if I went a little too quickly there. And you can see where that is going to sit. So it is not your Adam's apple. A lot of people, they'll think of your Adam's apple here as being the point of your hyoid bone. That is wrong. It is much more superior than that. Going to be up here. If you push hard enough on the base of your head, neck area where they meet, you can kind of feel like your tongue is moving in that area if you're moving around that hyoid bone. But that is where your tongue is going to be attached to, but the hyoid bone is not attached to any other bones. Okay, so those are the fossae and the hyoid bone. Thankfully, we're able to finally finish 7.2 with video C here. So if you have any questions, or especially with any of those foramen or foramina or different things like that, since they are very small and you have questions on them, make sure you are letting me know.